Hi, I am Diana Londoño. I'm a urologist in Los Angeles. And today we're going to talk about blood in the urine. So, blood in the urine is never normal. Okay. If you ever see this, you need to see a doctor right away. And basic things have to be checked to make sure what's going on. So, if you see blood, the first thing you have to check when you go to your doctor or urgent care or the ER is a urine analysis has to be checked and a urine culture. This gives us information to see if there is bacteria in the urine, because one of the causes of blood, and the most common at times, can be an infection. But blood, if it's coming from an infection, will also have other symptoms, such as frequency to pee. You have to go a lot. There's going to be pain, an urge to go. There's going to be a smell to the urine. It's going to hurt, or it's going to be difficult to pee when there's an infection. You could also have fevers or chills, or just not feel well overall. So it's really important that the urine analysis and the culture is checked. And if you're having those symptoms as well, then many times antibiotic will be started. And once the results come back, it will tell us which antibiotic is the correct one. And we may need to switch it depending on the results. Many times an antibiotic that we give you could be resistant. That means it does not work and it has to be changed to the correct one. So the culture will give us that information and then we could change it depending on that. Depending on your age or your sex, the length of the antibiotics will depend on that. So your doctor will tell you how long to treat it. So if you see the blood, it has to be checked. Now, there's also something else when there's blood that you don't see yourself, but when a urine analysis is checked, there could be blood that you don't see, but it's called microscopic hematuria. Fancy name to say, we can see the blood under the microscope, even though you and I cannot see it. What's really important is that microscopic hematuria really says that it has to be looked at under the microscope, and it has to have a certain threshold. That threshold is 3 RBCs per high power field. And RBCs means red blood cells per the high power field. The high power field means the microscope. So if the little dipstick down in the office or urgent care, that does not diagnose it, or even if you do a home test, you need to have this been sent to the lab, and is not a trace. It really is that 3 red blood cells per high power field, no less. If there's less than that, you don't need any further evaluation by a urologist or anybody else. But if it does show the 3, then you have to see a urologist because other tests may be needed. So if there is blood without an infection, or definitely microscopic blood or microscopic hematuria, heme means blood and turia means from urine, then you need to see a urologist. Then we're going to talk about, well, where is this blood coming from? And blood in the urine can come anywhere that the urine is made or it passes. So urine or pee is made in the kidneys, which lies at the bottom of our ribs in the back. And the urine is made there. Then it travels down a tube on each side called the ureter. And then it is stored in the bladder down in your bottom of your belly. And it's stored in the bladder. Once you feel the need to go, then you go and you pee and you empty your bladder. So anywhere the urine passes, that's where the blood could be coming from. So it's important to do some tests to figure out where this is coming from. So the tests that are usually needed are, we're going to check your kidney with some blood tests that is non-fasting to make sure your kidneys are working well. And if you're a man, a PSA or a prostate-specific antigen test is also usually checked to make sure this cannot be coming from prostate or signs of prostate cancer or infection or inflammation. So once the blood tests are checked, then we're going to check a picture of anything coming from the kidneys down below the ureter. And the tests to do so are the following. You can get a CT urogram. It's a specialized CT that times when dye, which is iodine, goes down the ureter. A CT scan has iodine, and that is the dye that we're able to see, again, what's happening in the kidney or the ureter. If you cannot have iodine, then another test could be an MR urogram. So it's an MRI with the same timing of going down the ureter so we can see better. And that can also be helpful if you cannot have the CT scan because of the dye. If your kidneys don't work well and you cannot have any iodine or gadolinium, which is a dye for the MRI, then you could have a CT scan without contrast or an ultrasound of the kidney. But they are not as good of a test, so we can't see as much detail as we would like. But they could be starting tests that you can have if there is blood. Now, when we've looked at the top part, that is very helpful. But then we have to look inside the bladder and through the urethra, which is where you pee out of, to see if there's blood coming from there. And unfortunately, CT scans, MRIs, ultrasounds cannot show us inside the bladder. I have another video talking about cystoscopy and what it is and what we're looking for. So please check that out. We'll give you more information. Or there's one about prostate biopsies. If you're a man and you've been told you need a prostate biopsy, it'll explain what the prostate biopsy is and how that's done. But again, to look inside the bladder for the causes of blood, we need to do that cystoscopy, which is where a small camera goes in to your bladder and we look at the surface of the bladder. This is done in the office. It is not something that needs to be done in a surgical center or a hospital, and you can come in without fasting, you can drive home, and it's a pretty quick procedure that gives us a lot of information. So what are we looking for with a cystoscopy or with a CT scan? So again, we're looking to what could have caused blood. If there's been a trauma or accident or a fall, well, that can definitely cause blood to happen because the kidney or the ureter or something can be injured. But it can also be because there is an infection of the kidney, infection of the urine in the bladder, infection of the prostate, or even testicles can cause blood. It could also be that the urine is not draining well and there's some type of blockage from something blocking the urine from flowing out. It could be a stone, it could be a tumor. It could be that the urine within the bladder is not emptying well. So even though you are peeing, you're leaving behind urine in your bladder. So that could be a cause of blood, that you just can't empty the bladder very well. If your prostate is large, it can also cause symptoms. And the bigger it is, the more blood flow it has, and it can definitely bleed without having any cancer, but that could be one of the sources of blood if you're a man. Again, kidney stones can cause blood because they are not smooth little stones, but they have sharp edges and they can sort of scratch the surface of the kidney or the ureter and cause blood. Any type of tumor or growth anywhere along where the urine passes could cause blood. And there's also kidney cysts, which are just fluid-filled, sort of like blisters, we'll call them, within the kidney. That could be a sign of blood or could be just picked up when we do the test. You could also have masses or tumors or cancer growths within, again, the kidney, the ureter, the bladder, prostate, urethra, anywhere the urine passes. In the urethra, especially in a man, which is a long tube in the penis where the pee comes out of, there could be a narrowing or a stricture. So we will be able to see that with the cystoscopy that otherwise we can't see with any other test. If there's a fistula or abnormal connection from the intestine to the bladder that shouldn't be there, that can cause infections, but also cause blood. And we'll be able to see that on a cystoscopy and sometimes on the scan as well. Rarely, if there's any bleeding problems or blood clot problems, that can cause blood to occur, or if there's tuberculosis as well, which is pretty rare, but it could be a reason there's blood. Again, we got to do these tests, including the CT scan, the blood work for the kidneys, for the prostate. We usually also check out urine cytology, looking for cancer cells in the urine, and we'll look inside the bladder to figure out the source of the blood. There's also some medications that can make your urine look red or change in color or cause blood. So talk to your doctor about medications that could be causing this. And there's some foods like beets that can make your urine red as well. But please remember, blood in the urine is never normal, and you need to see your physician right away and possibly a urologist if especially there's blood without an infection or there's a microscopic hematuria. Remember, this is for education. It does not diagnose or replace your doctor. But if it was helpful, please share, please subscribe to the channel so you can learn more about things that are important to you and your health. Thank you so much for watching.